Kerala's achievements on the healthcare front have been much extolled. The state is far ahead of many Indian states on many fronts like maternity health care. Then child mortality rates are very low in Kerala. Often health standards of Kerala are being compared with that of Western countries. And at times Kerala is said to excel even US health standards. But are those achievements the result of any policies implemented by left groups in Kerala? There is a tendency among even some experts to project that the achievements of the state on healthcare front is a result of certain policies of the left. This is far from truth. This is absolutely fabricated. The other day, an expert in the healthcare sector, to be specific, Rajiv Sadanandan, who was formerly the Secretary of Health Secretary in Kerala, who, as the additional Chief Secretary, who oversaw many projects on the healthcare front, and for several years he was in charge of the healthcare sector in Kerala till the recent past. He gave a candid interview to a Malayalam channel which was quoted by other Malayalam media also. In that interview, he was heard saying that the tendency of Kerala to project the achievements and claim as number one should be discouraged. He said there are many basic flaws on the healthcare sector in Kerala. Kerala's policies are not, adequate to maintain the achievements of the state in the coming years. Regarding the funding for the healthcare sector, he said that was primitive. Of course, that is a controversial remark. Then again, he made a doomsday prediction that in the coming days, the middle class of Kerala will find that healthcare has become unaffordable. This is a shocking statement. He says, like in the United States, many people in Kerala won't be able to afford medical treatment. If that becomes true, it will be, a shocking situation. All the gains or achievements of the state will be negated in a few years. Many people think that, when you take into account the expenditure on healthcare sector, government bears the lion's chunk, but that is far from the truth. According to surveys, actually the gains in on the healthcare front in the state are because of spending by individuals. I will come to that details. And another important revelation made by Mr. Rajiv Sadanandan was almost 70% of the hospitals in Kerala are now in the private sector, not in the government sector. So things have changed in Kerala. Kerala need to realize what happened on the healthcare front in Kerala. He says in cities, hospitals are being controlled by, groups which are not even India based. Many of the hospitals in Kerala are being controlled by venture capitalists or other fund managers who are based in Singapore or the West. So this gives us a clear picture of what has really happened in the healthcare front in Kerala. Let's take a closer look into the healthcare sector. Welcome to Insights. I am Hari Kumar. Mr. Rajiv Sadanandan quoted a survey done by National Sample Survey Office. That the survey was Annual Modular Survey 2022-23. He quoted figures from that. He noted that out-of-pocket expense for healthcare sector was highest in Kerala when compared to other Indian states. It means individuals on their own are spending more money in Kerala for healthcare compared to other states. In other states, actually the state is spending much more. So the achievements on the healthcare front in Kerala can be said, or achievements are a result of expenditure borne by individuals. The government has a little role in it. So when political parties try to take credit of the health standards of Kerala, they are actually lying. There is no truth in it. For example, household expenditure, annual household expenditure in urban areas for hospitalized treatment in Kerala is rupees 10,341, out of which around 8,000 is spent by public from their own pockets. So this is the situation. Again, when it comes to rural household, the expenditure is 8,655 rupees. So you look at the out of pocket expenses borne by individuals or families. For non-hospitalized treatment also, this is true. It's not the government spending. It is spending by individuals, households. Why people are able to do so? Because of remittances, not because of the progress of the state. This is not I wanted to say that the achievements of Kerala on the healthcare front are a result of the increased spending capacity of the public, which is because of their migration to foreign countries. They are able to afford that because they earn huge money from foreign countries. The political parties in the state, or especially the left, have nothing to do with that. They have actually decelerated the progress. They have actually pulled back. They actually took credit of the achievements that happened in Kerala in previous years. If you look at the achievements of today's Kerala, you will realize that they were actually an outcome of the initiatives taken by former kings that ruled in Kerala, especially Kochi and Travancore. It was surprising. Actually, in late 1800, vaccination was started in Kerala against many epidemics or diseases. This is surprising. This is, a king had the acumen to do that. He had the willingness. Travancore kings had the willingness to do that. They even took vaccinations themselves to allay the fears of the public. They conducted health surveys. The first public health center in India was opened in Kerala because of the initiative taken by Travancore king. They started, hospitals in the government sector. They introduced Western medicine in the state. They periodically conducted health surveys in Kerala. They even started a sanitation department. You could not imagine that. So they were rulers who were committed to the welfare of their people. And actually, the left that came to power in Kerala in late 1950s wrote piggyback on the achievements of, Travancore kings. This is the truth. But nobody realizes that nowadays. People think that it is because of a left government in the state that the state is spending more for human development. The state is caring more for the healthcare of the public. This is far from the truth. This is totally fabricated. This is a red lie. Now, Mr. Rajiv Sadanandan says those achievements are being eroded. For example, he says the attitude of people is also one reason. He says people are unwilling to go to primary health centers, and instead of that, they are rushing to secondary and tertiary centers, which creates a big crowd there. And because of that, often there are lack of resources there at the tertiary centers. People don't go to primary health centers. They directly rush. And as I said earlier, 70% of the hospitals in the state are now owned by private sector. In big cities, hospitals are not even owned by Kerala businessmen or industrialists from Kerala. They are owned by people who are fund managers for example, venture capitals or other funding agencies based in Singapore, United States, Europe, etc. Their sole aim is to create to make money. You cannot blame them for that. So this is the situation. He says policies of Kerala need to be changed urgently, or otherwise, within a decade, the common man, not the common man, even the middle class in Kerala will find hospitals or medical treatment unaffordable. When it comes to insurance or funding, it's also not adequate. There are many flaws in funding, healthcare funding. This is what he says. So I think in the coming days, Kerala is going to face the reverses or the negative impact of healthcare policies. If the state fails to do an honest introspection, if the state doesn't stop tall claims, and if political parties in Kerala don't stop trying to exploit the gains of Kerala and taking advantage of that, then the advances or achievements of the state will be nullified. So, this is a serious reminder. I hope the political parties in the state will, uh, you know, realize the reality of the situation, and they will take adequate steps to rectify uh, the wrongs. I will meet you with updates. Till then, goodbye.